Good morning, COPD and asthma heroes. I'm Denise Goslin, a respiratory therapist and certified asthma educator, as well as the program manager at Nightingale Virtual Respiratory Care by Healthcare Originals. On behalf of the Nightingale staff, I would like to welcome you and thank you for taking a few minutes out of your morning to participate in our fourth live session. The first three sessions, Jan's medication devices, Sarah's moving more, and Denise's moving mucus, are pinned to the top of the Nightingale Facebook group pages. So if you didn't see them or you want to rewatch them, they're right there for you. In the chat, please type your first name and the state where you're at so we can see how far and wide we're reaching people. Also, please write any questions you have and we will get to them during the session. This session will be pinned to the top of the Facebook page in the near future, so you can watch it again, or anyone who was not able to make it today will be able to watch it. So right now, I'd like to give a shout out to Jan in Colorado, and Eric in New York, and Yvonne in New York. Thank you all for joining us. Before we begin, I'd like to remind you that why do I need to take so many inhalers is general information. Always talk to your healthcare provider about the best options for you. Because next to you, your doctor knows you best. And we all have different medical histories. So, again, this is general information. Today's topic, why do I need to take so many different inhalers, is something that respiratory therapists get asked a lot. We've also seen many comments and questions in the Facebook group discussion regarding this topic. I'd also like to give a shout out to Sarah in New York. And please, again, feel free to just give us your first name and the state where you're at, and then we'll know how far and wide we're reaching on this morning. So now I'll introduce Cindy. She is one of our respiratory therapy coaches here at Nightingale, and she's going to present why do I need to take so many different inhalers?
Thank you, Denise, for the introduction. And this is a great question. Why do I need to take so many different inhalers? So, medications for asthma and COPD fall into two categories. Control medications and quick relief medications are the two categories. Control medications are taken every day to prevent flare ups. Quick relief medications relieve the symptoms, such as coughing, COPD, and wheezing. Most people with asthma and COPD use both types of medications. There are so many different inhalers and medications out there. Your asthma and COPD may change over time. As your asthma and COPD changes, you may need to change your medications or add a medication. Let's talk about control medications. Control medications work in several different ways to prevent asthma and COPD from flaring up. Some also help open up the airways. Some people need more than one medication to control their asthma or COPD. Examples of some control medications are Advair, Dulera, Flovent, Pulmicort, Symbicort, and Trilogy. And here's an example of Trilogy. These medications are just some examples of inhalers that are available for controlling your symptoms. There's many more. Control medications do not work quickly enough to help prevent during a flare-up. They don't help you quick. You will need a rescue inhaler to help open up your airways quickly when you have a flare-up. Rescue inhalers for relieving symptoms. Your rescue inhaler works by relaxing the airway muscles. Used early enough, they can help keep your flare-up from getting worse. These drugs begin to work in minutes, and the effects last 4 to 6 hours. Also, they can be used before exercise. Examples of rescue inhalers include albuterol, some brand names for albuterol are Proair, Preventil, Ventolin. And here's an example of a quick reliever. This is Ventolin that I'm holding up. Another rescue inhaler is called Zobanex that's out on the market, and another one is Atrovent or ipratropium. Now on to our Facebook quiz results. Which of the inhalers listed below are considered rescue medications? That was out on our Facebook, and the question goes, which of the inhalers listed below are considered rescue medications? Proair, Ventolin, Preventil, or all the above? All of the above is the answer, and 2/3 of the COPD and asthma heroes answered it correctly. Congratulations, great job. Let's recap the medications and quick relief medications. Medications for asthma and COPD fall in two categories: control medications and quick relief medications. Control medications you take every day to help prevent the flare up, and it reduces the swelling of the airway. Quick relief medications relieve symptoms such as coughing and shortness of breath. Okay, so now we're going to go into the questions that you have posed, whether live here or out on the Facebook page. So now Jan is going to join us and answer the questions you have posted on Facebook.
Hi there, heroes. I'm joining you from Colorado today, and I'm a respiratory therapist here at Nightingale, and I've been keeping a really close eye on the Facebook questions, and we're seeing more and more people engage with the Facebook heroes pages for both asthma and COPD, and we hope that we just continue to grow that because we love seeing those questions and being able to get on there and answer them for you. We asked for some questions about this topic today that Cindy just presented on, and I'm going to answer those questions. So I have a few here. The first one we had came from Lori, and Lori wanted to know why, when she takes her inhaler, it kind of puffs around the cylinder. She said that didn't used to happen and she didn't notice it. So there's a couple of reasons for that if it does that. If you're not using it very often, and I'm going to show you this albuterol inhaler I have right here. This is a blue one. It's a newer one that people are getting now. And there's a couple of reasons why that could happen. First of all, every inhaler you have and you get it out of the box, you have to prime it according to the manufacturer's directions. And all inhalers can be different in their directions on how to prepare it before you use it the first time. So I know we don't like to read pamphlets, like who wants to read a pamphlet? But try to look at the, if you get a new inhaler, try to look at the pamphlet and the instructions. Usually they have pictures with them, and they might tell you how many times that you need to give it some test puffs, right, before everything's mixed together and ready for you to start using it. You have to remember that most inhalers, unless they are a dry powder that you suck out, right, most inhalers have a gas propellant in them. That is what makes the spray come out nice and soft, and it mixes together with the medicine so that you can get the medicine into you. So the reason that you want to prime it when you use it is it's been in the box and it hasn't been used before. So look and see how many test puffs they want you to do in the air before you use it. That way, when you go to get your medicine, it's ready to go. And then they will also, for almost every inhaler, it's important that you give it a few shakes and that you keep it in this upright position after you use it the first time if you have 2 puffs, so that it can prepare the next puff for you. So another thing is if you've had it in a drawer and you only use it intermittently, you don't need it all the time, and it's been there a long time, there can be some instances where the inside, right, this is the medication, where the inside of the canister can kind of get crusty and clogged up. So also look at that pamphlet to see if they suggest that you can just clean the canister, just the outside part, let it dry out completely, and then it'll be ready to go. So those are a few reasons why you feel like you're getting it and it's coming outside of the canister instead of in your lungs, like we want it to be, right? Another solution for that, which might help, of course, and we're always going to recommend, is a chamber, right? Remember, chambers give you up to 80% more medicine. So you can see a previous video that we did on why nebulizers versus inhalers, and we talk a little bit more about the chamber. So if you can use a chamber, then try to use it. All right, next, Amber asked a question about the current albuterol shortage and if it's going to increase the price. So I don't know. I don't have anything to do with pharmaceutical companies, but I know in the past in the hospital and in the pharmacies, when there have been medication shortages on other medications, respiratory and otherwise, then when the shortage is over, the price isn't usually increased. So I wouldn't worry about that too much. The reason there's a shortage, actually, and it's just on the nebulizer side, it's not on the inhaler side, is that there's several factories that make certain medications. And some of the factories for the company that made the nebulizer bullets for the nebulizers, for mainly the hospital, the factories shut down. So then you have less factories making it. So then it creates a shortage. Well, now it's kind of crossed over to the home nebulizer side, if you might have noticed that in your pharmacy. And one reason for that is that people start to hoard it. Right? People see albuterol nebulizer shortage, and then they're like calling their doctor and they're saying, I want as much as I can get. And what happens is some people hoard it, and then it just adds to the shortage. So if for some reason they don't have your bronchodilator that you usually get for your nebulizer at your pharmacy, there are substitution bronchodilators. So just call your doctor and say, my pharmacy doesn't have my Duoneb or my albuterol or whatever you use, and they can probably call you a substitution. And there are other factories that are starting to manufacture it. So that shortage should be corrected soon. Don't panic about it. I know it's always worrisome when your medication isn't available at the pharmacy, but it should be rectified soon, and there are substitutions available. So that's the question from Amber about the albuterol shortage. Again, I don't know if the price is going to increase, but in the history when we've had shortages, it doesn't. So all I can say is, let's hope not. Nancy asked a question. Nancy said sometimes she doesn't feel like she's getting her inhaler medication with one puff. Can she take another? Basically, you need to take how many puffs the doctor tells you to take. So when you get your prescription, look at the box with the sticker on it from the pharmacist, look at the paperwork that comes with it, or ask your doctor. And if the doctor says to take one puff, only take one puff. If the doctor says to pump it 2 times, then take one, wait a few minutes, and then take the other one. Kind of gives you a chance to open up before you take your second puff. Your lungs can relax, be able to take another deep breath. But you want to follow the doctor's directions on how many puffs to take. Now, a caveat to that, if you do use a chamber with your inhaler, right? If you pump it and one time, you can also take a second breath out of here if you don't feel like you're getting all of the medication, because some of the medication might still be circling around in this anti-static chamber. So it's okay to take a second breath, but don't necessarily pump it a second time unless your doctor tells you to take 2 puffs. Okay? And also remember to prime it when it comes out of the box, the way the directions say, and then to shake it before you use it in most cases. Okay, and the last question that I'm going to mention came from Susan. And Susan made a statement. She doesn't feel like her Brio is really helping her. So Brio is one of the combination medications like Cindy was talking about. There's medicines that will just contain one medication, inhalers, but there's also combination medications out there that include things like an inhaled steroid and a long-acting bronchodilator. So those medications there's more and more coming out, and from really studies they're coming out with new and improved steroids and long-acting bronchodilators all the time. And they're even coming out with medications that can have 3 things in them. So if the Brio, or if your inhaler, if whatever you're using, she said she was using it for a couple of years and she just doesn't feel well. If it doesn't seem to be working for you, there are different brands of different inhaled steroids and long-acting bronchodilators, and your doctor can probably prescribe you to try a different one. You have to remember that medications are not one size fits all, right? An example is a blood pressure medication. You might have to try 1 or 2 or 3 if you need blood pressure medication before you find the one that has the right things in it that work for you. So if it's not working for you, talk to your doctor about it and say, I've had this for 2 years and it just doesn't seem to be working for me. And they might try a newer one or just a different one with different, of the same medications, but different ingredients. And it might work for you better. So that's the questions that we got on the Facebook pages for this topic. We'll have another video next month, and we're going to give you plenty of chances to ask other questions so we can answer them and say hi to you. So I don't see any questions in the chat. Thanks for letting me tell you a little bit about the Facebook pages. Please engage. Please say hi to us on the Facebook pages. We know that you're there and you're looking, and we want to be able to engage with you. So bye from Colorado. Thanks for joining me.
At this time, Denise is going to wrap up.
Hi
Thank you,
guys,
Denise.
I'm back. One thing I did want to mention, just bouncing off from what Jan had said, when you rinse your plastic inhaler, this comes from Flovent, you might see that the hole inside there can get plugged up. So one of the things we often say is just use a wet toothpick and kind of plug it over that little hole in there. Because, with the HFAs in that, they do tend to kind of block up. And that could be partly why sometimes you feel like you're not getting as much medication as you think you should. Also, some inhalers, like your dry powder inhalers, only have a teeny bit of medicine in it. So you might not feel like you're sucking it in, but you actually may be. So, all right. Now, the other thing I wanted to say is, thank you so much for all those questions and for your time today. Feel free, again, if you have more questions, to post them on Facebook. We're happy to answer them and be a great support for you. And this session will be pinned to the top of our Facebook pages shortly. We'll also post the picture or link for the inhaler chart that we showed you in case you wanted to see that. That comes from the Asthma and Allergy Network site. And it might be something you can take to your doctors and you guys can discuss which ones, might work for you. If, as Jan mentioned, something seems to be not working, you want to be able to sleep and play and do your normal activities with minimal interference, or maybe with no interference if possible. But all right. And our next session will be April 26th at 3 o'clock Eastern Time. I will speak about allergies. So until then, thank you to Cindy and Jan and to all of our participants today for showing up. And you guys all have a great day and a great month, and looking forward to seeing you next month. Bye-bye.